Hello, you are welcome to KB Nurses Documentary, and here is the first episode of our educational video. Osce is being introduced into basic nursing professional examination by the Nursing and Midwifery Council of Nigeria in the year 2018. An objective structured clinical examination, also known as Osce, is a performance-based assessment used to measure candidate clinical competence. During Osce, candidates are observed and evaluated as they go through a series of stations. Attention is being paid to the objectivity of the examination. This is according to Harding, 1988. An Osce usually comprises a circuit of short stations of 12. The usual time to be spent on each station is 5 minutes. This is according to Nursing and Midwifery Council of Nigeria, in which each candidate is examined on one-on-one basis by a number of impartial examiners with either real or simulated patient. Each procedural station has a different examiner. Candidates rotate through the stations in a clockwise direction, completing all the stations on their circuit. In this way, all candidates take the same stations and are evaluated by the same examiners for fairness and objectivity. In an Osce, all candidates are assessed using exactly the same stations, instructions, checklists, questions, and marking scheme. Instructions are carefully written to ensure that the candidate is given a very specific task to complete. Features of the objective structured clinical examination, that is Osce. Usually 12 stations, 6 procedural stations in an odd numbers, and 6 question stations in even numbers. These question stations are also being referred to as silent stations. Procedural stations are highly focused. Candidates are given very specific instructions. The examinee spends 5 minutes on each station. All equipment needed for a particular or specific procedure are being provided to the candidate by the examiner. Most often, 1 out of the 6 procedural stations is on health education. Examination hall is a hospital ward or school demonstration room. Atmosphere used to be active, busy, and lively. Sometimes we do have rest or resting station, and this rest or resting station is used to be provided in order to complete some cycles. Remember, I told you earlier before that we have, or the cycle goes in a clockwise direction. Now, usually, these are the 12 circuit stations, starting with station 1 to station 12. Out of these 12 stations, we have 6 procedural stations which are always in odd numbers. For instance, this one is a procedural station. This one is a procedural station. This one, 5, is a procedural station. 7 is a procedural station. 9 is a procedural station. And 11 is also a procedural station. All these are odd numbers. Now, the question stations. Now look at how many stations now are left behind. We have 12, we have 2, we have 4, we have 6, we have 8, we have 10. All these are question stations, and those are even numbers. Here we have question station, question station, question station, question station, question station, and the 10 also question station. Out of the 6 procedural stations we have mentioned in even numbers, 1 usually used to be talking about or ask the candidate on health education matters. It could be procedural station 1, it could be procedural station 3, procedural station 5, procedural station 7, 9, or 11. 1 out of these must talk about health education. This is something that each and every candidate should put into consideration whenever he is preparing for an Osce examination. Tips for a successful Osce examination. The following tips should be considered and should be given greater priority by all candidates whenever they are preparing for an Osce examination. Candidates are expected to sleep for at least 4 hours and wake up 3 hours before the start of the examination. Make sure that you eat something light before you approach the examination venue, but never go with an empty stomach. Appear neat and tidy in a complete uniform. Attach your examination tag on your uniform for easy identification. Try to compose yourself. Be calm and avoid unnecessary discussion with colleagues. These discussions can serve as distraction. Switch off all your phones to avoid being a victim of examination malpractice. At every procedure station, greet the examiner, but don't wait for the examiner to respond to you. Make sure that you read the instruction twice. When in doubt, ask the examiner for clarity. At every question station, firstly, write your candidate examination number, and after which, try also to obey the following. Read the questions carefully and thoughtfully. Don't waste your time waiting for a miracle to happen if you don't know the answer to a particular question. Always try to turn over the page. If you still have time, try to answer the skipped question. Try not to leave the question paper exposed on the table by dropping it in the appropriate container provided for the question paper. Thank you for watching this first episode of our educational video. Don't forget to subscribe to our YouTube channel at KB Nurses Documentary. Click on the notification button so that you can have the opportunity to watch our new episode of educational videos as soon as we drop them. Thank you.